So placenta is a discoid, deciduate, hemochorial structure. So why do we call it discoid? Huh? Because it is disc shape. Okay. Why we call it deciduate? Huh? No. We call it deciduate because it expels. Okay. It doesn't stay with the uterus. After delivery, it expels from the uterus of the mother. Why do we call it hemochorial? Why do we call it hemochorial? Chorial is the chorion of the placenta. Okay, the chorion of the placenta is in constant touch with the blood, so we call it hemochorial. Okay, the weight of the placenta, normal weight is 500 gram. 500 gram, it has 500 ml blood inside the placenta. Okay, in that 500 ml, when 120 ml will be in intervillous space. See, this is the maternal surface, sorry, this is the fetal surface of the placenta. We call this chorionic plate. This is the chorionic plate. Okay, this is the maternal surface. We call it decidual plate. Okay, the functional unit of placenta is what? Functional unit of CNS is what? Neuron. Functional unit of placenta is cotyledon. Okay, this individual chunk, this is a cotyledon. Around we have 15 to 20 cotyledons inside the placenta. Okay, see this fetal surface, this is shiny. Maternal surface is rough and reddish. Okay, it is not covered with membranes, but the fetal surface is covered with a membrane. Okay, there is a chorionic layer, and the chorionic layer is covered by a surface of amnion. Okay, this is the amnion layer. Okay, this membrane, that is the amnion layer. Tar niche there is a chorionic layer, then the total placenta is there. Okay, this membrane, okay, it is very useful. It is totipotent. You know what is totipotent? It can give rise to anything. It has cells like that. The cells of the amniotic layer are totipotent. Okay, we use this membrane in many places. You know what is vaginoplasty? What is vaginoplasty? আরে কিছু একটা বল, কিছু একটা চেষ্টা কর। Repair of vagina. Plasty, what is plasty? Surgical procedure সবকটা আমরা প্লাস্টিক বলি। Plasty is reconstruction. Okay, we are reconstructing a vagina. Whom do we reconstruct a vagina? There is, if the patient is having a MRKH syndrome. Okay, or what is MRKH syndrome? MRKH, Mayer Rokitansky Kuster Huster. Okay, you just remember MRKH as for now. Okay, in these patients, what usually we have, the mother has a uterus, okay, and a vagina. No, these patients will not have a proper uterus or vagina. The uterus will be very short, small uterus, and vagina, it will be a blind vagina. Okay, there will be no vaginal opening. In these patients, we have to reconstruct the vagina. Okay, so vaginally we have to create an opening for her sexual, to keep her sexual function intact. We create a vaginal opening, that we call it vaginoplasty. Okay, after doing the surgery, we keep a mold. mold is a device, okay, it is in shape of a male penis, okay. After the surgery we insert this mold, okay. What we do, the mold, no, it is made up of plastic only, okay. That mold we use this amnion membrane to cover and we insert it, okay, so that it forms the vaginal epithelium. So it helps in forming the vaginal epithelium. It cannot form 100%, but it can mimic, or in little bit it can mimic, okay. So we use this membrane in vaginoplasty. Okay, the functional unit of placenta is what? Cotyledon. How many cotyledons? There are 15 to 20 cotyledons, okay. These cotyledons have approximately 120 blood vessels, okay. The normal uh, placental feto-placental blood flow, feto-placental blood is 400 ml per hour, okay. Uteroplacental blood flow is 450 to 650 ml per hour. Mane from uterus to the placenta per minute there is 450 to 650 ml of blood, and from the placenta to the fetus there is 400 ml per hour. Sorry, per minute. Sorry. Minute. Uh, the normal thickness of the placenta is 2 to 4 centimeter. The thickness, no, this thickness, it is normally 2 to 4 centimeter. If the thickness is more than 4 centimeter, what do we call it? We call it placentomegaly. Very good. Placentomegaly. Okay, if it is less than 2 centimeter, what do we call it? Small placenta, okay. Okay, when can we have a placentomegaly? Tell me the causes of placentomegaly. When can we have a placentomegaly? Big placenta. When there is a big baby, there will be a big placenta. So when there will be a big baby? Any cause? Huh? RS negative. Okay. Most important cause of large baby is gestational diabetes mellitus or overt diabetes mellitus. Okay. So in that patients, GDM patients, GDM, means gestational diabetes mellitus. In these patients, we have big baby. Big baby, when we call the baby weight, if it is more than 4.5 kg. The baby's weight is more than 4.5 kg, we call it as a big baby. Okay. Gestational diabetes mellitus, we have a big baby associated with placentomegaly. Okay. So, what happens in GDM? আমি বলেছি মানে GDM causes big baby. Why does it cause placentomegaly? Why does it cause big baby? You guys are third year, right? You finished pathology. Huh? একটু জোরে বল। নিউট্রিশন বেশি হয়, ঠিক আছে। বাচ্চা কি মানে খাবে পেটের ভিতরে? সেম ব্লাড সাপ্লাই অনলি। বেবি আলাদা খাওয়া দাওয়া পাবে না, অনলি দিস ব্লাড। এনি আইডিয়া? ও বুঝতে পারছে না? হ্যাঁ, so GDM patients, what do they have? Diabetes patients, they have increased insulin secretion. Insulin is a anabolic hormone. Okay, wherever you give insulin, anabolic money it takes things, it forms things. Okay, so insulin when there is increased insulin secretion, there is something called IGF, insulin dependent growth factor. Okay, this causes excess of fat deposition of all the hormonal changes. Okay, and there is the cell mass also increases and the number of cells also increases. Okay, that causes a big baby and placentomegaly. And there is something called this is a hyperglycemic state. Okay, glucose is more. Okay, what it does, it causes villus edema. ওকে, ভিলেস এডিমা মানে তো মানে ফুলে যাবে, ভিলাইগুলো ফুলে যাবে, তার জন্য there is more space, sorry not more space, it takes up more space. So there is placentomegaly. Apart from GDM, torch infection. What is torch? Torch congenital anomaly সবাই বলতে পারে, বাচ্চারা বলতে পারে. What is torch? Yes. Okay, and anemia, maternal anemia. These causes and other infections also. Okay, these will cause placentomegaly. What about small placenta? Tell me the causes of small placenta. Bolo. Yes, very good, small baby. Okay, when there will be small baby? Exactly, it is like that. Small uterus, bhai. Ye to ta jasna. Please. Small uterus, small mother, small child. In IUGR. What is IUGR? Intrauterine growth retardation. Okay. Preterm. If there is any infections also, the placenta is small. Okay, out of this placenta, 4/5 is fetal component. 1/5, only 1/5 is maternal component. Okay, the maternal component is derived from the decidua basalis. Fetal component is derived from chorion frondosome. Chorion frondosome. Okay, 4/5 of the placenta is fetal derivative. Okay, from chorion frondosome. 1/5 is maternal component. It is derived from decidua basalis. The uterine endometrium has two layers. Okay, one is decidua basalis. Arecta key. Arecta parietalis. Decidual functionalis. যা কিছু বল. Okay, this basalis layer. Okay, this is the uterus. This is the endometrium. endometrium এর নিচের পার্টটা আছে, that is decidua basalis. তারপরের যে লেয়ার আছে, that is decidua functionalis. Okay, this functionalis layer, every time when you have menses, bleeding, only this functional layer will shed off. And the upper part of the decidua basalis, this will shed. This decidua basalis has three parts: basal layer, middle spongy layer, and superficial compacta. Deciduobasal is as a compacta, middle spongy layer and basal layer. Okay, between this compacta and spongy layer there is an interesting thing called neta bush layer. Neta busch, neta bush layer. Okay, whenever there is bleeding, okay, or when the placenta separates, the separation is at the level of spongy layer. Okay, this decidual plate, okay, it does not go beyond the basal layer, এর নিচে যাবে না. Okay, so plane of separation of placenta is what? Spongy layer. Okay, what is the importance of neta bush layer? এটা আলাদা করে বললাম কেন? Have you heard about okay, what is you know what is obstetrician's finger? You don't know what is obstetrician's finger? You don't know, you know what is nightmare of obstetricians? There is a term called nightmare of obstetricians. Every obstetrician will have a nightmare. That is this case. What case? That is called placenta accreta. Placenta accreta we call obstetrician's nightmare. Okay, we are very brave people, but placenta accreta, it is not a normal thing. Okay, what is placenta accreta? There is a uterus. Okay, this is the placenta cord. Okay, normally the uterus is attached to the endometrium. Okay, if it invades the endometrium, okay, if it invades the endometrium, we call it placenta accreta. Okay, if it penetrates the myometrium also, we call it placenta increta. Okay, if it penetrates the uterus, there is bladder, there is rectum. If it penetrates the bladder and it attaches to the serosa, it crosses the serosa of the uterus and it attaches to somewhere, structures somewhere. Bhabo, this is the bladder. Or if it attaches to the rectum, okay, we call it placenta percreta. Placenta accreta, placenta increta, placenta percreta. Understood? Okay, normally when I told you the plane of separation of placenta is at spongy layer. Okay, in this type there is the neta bush layer ache na, this layer is absent in these mothers. Okay, so what the neta bush layer does, it does not let the placenta invade. Okay, ওই basal layer আগে ও prevent করে দেবে, it doesn't let it invade deep. Okay, when this neta bush layer is absent, it invades. If it invades the endometrium, this is accreta. If it penetrates the myometrium, it is increta. If it penetrates the serosa also and it attaches to the other structures nearby, we call it percreta. Percreta per all the layers. Okay, this together we call what? Placenta accreta disorders. So this we called obstetrician's nightmare. Can bol? Why will it be a nightmare for obstetrician? It will not expel. Okay, প্রচুর bleeding হয়. After delivery, the placenta should separate. Last I had a PPH class with you, right? I told when the placenta is stuck, what happens? There is PPH. Okay, so in this mothers, placenta doesn't deliver. প্রচুর bleed হয়, we can't arrest this, we can't stop the bleeding only. So what we have to do, we have to do hysterectomy along with cesarean section. In these cases we have to remove the whole uterus because of this placenta. And if it invades the bladder, it is very difficult. Hysterectomy though you can do, you can't remove the bladder, you have to preserve the bladder. It is a very difficult OT. In my only once I have did the OT and it is very bad. Okay, now we'll go to placental abnormalities. Placenta succensuriata, placenta spuria, bilobate. Okay, tell me what is placenta succensuriata. Succensuriata মানে কি? Successive, জোরে বল, দুটো পাশাপাশি না, there is an accessory lobe. Okay, so if this is the placenta, placentar কাছে একটা accessory lobe থাকে এরকম একটা ছোট. See, this is a whole placenta, this is a whole placenta, right? In placenta succensuriata we have a small lobe along with this and the small lobe is attached with a vessel. Okay, so after delivery what happens, this will be attached to the cord. Okay, this placenta will get delivered and there is chances that this small bit will remain inside and we will not know that. What will it cause? প্লাসেন্টার একটা পার্ট ইউটেরাসের ভিতরে থাকলে কি হবে? ব্লিডিং হবে, পিপিএস হবে. So this will cause PPS. Okay, if it is a larger bit, okay, at the same time we can understand there will be bleeding, that will cause primary PPH. If there is a small bit, okay, uterus is contracted for at that time and later it might not, there might be atonicity later, that will cause secondary PPH. Okay, this we call it as succensuriata. What is placenta spuria? Same placenta is there and an accessory lobe is there, but there is no branches or connecting vessels. Okay, this we call placenta spuria. This also will lead to PPH. What is placenta bilobata? Bilobata, there are two placenta. There are two placenta and they are connected by vessels. Circumvallate, circummarginate. What is circumvallate and what is circummarginate? Okay, in circumvallate placenta there is a rim. In circummarginate also there is a rim. Okay, if we have a cross section, okay, it will be like this. This is the, what is this? Eta ki what is this? Maternal surface এর নামটা কি? Decidual plate. This is chorionic plate. Okay, this is the chorionic plate, this is the umbilical cord. ওকে কোরিয়নিক প্লেট আছে ঠিক আছে তার উপরে অ্যামনিয়ন একটা মেমব্রেন আছে একটা কোরিয়ন মেমব্রেন আছে and there is a fold okay this fold ওই fold is this one okay this fold will be present throughout okay this is the decidual plate normally this chorionic plate cp is equal to dp chorionic plate will be equal to the decidual plate for any placenta in this placenta the chorionic plate is smaller chorionic plate okay and what happens because of this smaller chorionic plate there is a gap here okay this there is possibility of blood entrapment okay and there is formation of fibrin okay so there is a decidual plate there is complete fold of amnion and chorion and there is fibrin okay what does it do this fibrin deposit it is a possibility of a infection anywhere if there is a blood clot that blood clot can have infection okay that blood clot has possibility of bleeding again also and this circummarginate there is just only a rim just একটা thickened rim আছে that is circummarginate this is circumvallate what is battledore placenta hey কি বোরিং লাগছে হাওয়া দিচ্ছিস কেন রে মানে এই তো গরমে কষ্ট করে ক্লাস নিচ্ছি হ্যাঁ what is battledore placenta see there is a placenta again okay placental membrane is there the blood vessel is attached to the this cord is attached to the membrane erom je membrane ache usually there will be central attachment okay sorry usually the placenta is attached at the center in battledore placenta the placenta is attached at the periphery at any periphery of the rim okay so what happens see this is the uterus bhabo if the placenta is attached here at this point what happens when the baby engages no this is baby's head mata what will happen it will what will happen cord এখানে আছে মাথা নিচে আসছে কি হবে cord will get compressed okay this is the opening okay if cord is like this baby's head will compress that will cause fetal distress sudden fetal death okay so there is a possibility of fetal distress and cord compression in battledore placenta okay next is velamentous insertion velamentous insertion mane the one I told there is a membrane and the cord is attached to this membrane placenta cord is not attached to the placenta as whole it is attached to the membrane and from this membrane there are vessels going this we call it velamentous insertion of placenta velamentous ta placenta আছে placentar সাথে একটা membrane আছে এই যে এরকম membrane this one okay cord is not attached centrally but it is attached to the membrane এখানে cord is attached at the periphery okay আজকে তোমরা গিয়ে কি করবি what are the placental abnormalities whatever I have told you you open Chrome and you see what are the different types of placenta and the images of that so that today only will have an idea about that velamentous insertion okay then okay Vasa, Previa. What is Vasa Previa? What is placenta previa? হ্যাঁ, previa, yes, uterus আছে, placenta নিচে আছে, this is placenta. Placenta is prior to the baby. Previa, placenta previa. What is vasa previa? Vasa is vessel, blood vessel. Okay, the umbilical cord, no, if I cut the umbilical cord, there are two arteries and one vein. Two arteries, one vein, very important. Okay. In this what happens, placenta is there, cord is there, okay, and without cord just the blood vessels are getting attached. Okay, so what happens, same scenario if it is at like this, okay, only the blood vessels are here, blood vessels are prone to get injured. Okay, so there is a possibility of what, bleeding. What is that? APH, antepartum hemorrhage. So the bleeding is before the delivery. See, the blood vessel is here and baby's head is here, it will obstruct the blood vessel. Okay, so there will be bleeding. This we call it as vasa previa. Vasa previa is the blood vessel before the fetal head. Bus. Then what is the normal length of the cord? Next, cord abnormalities. What is the normal length of the cord? Umbilical cord. It is 30 to 100 centimeter. Okay, if it is more than 100 centimeter, we call it long cord. Okay, if it is less than 30, short cord. If umbilical cord is long, lengthened, what can it cause? What can happen? Huh? If the cord is long, what can happen? কিছু হতে পারে? Yes, there is not strangulation, we call it baby ke hang করে দিবি না. Okay, we call it cord around the neck, nuchal cord. Nuchal is neck. Okay, there is something, no, in movies and all you would have seen, মানে হ্যাঁ দড়ি আছে, they say something like that. Okay, if till 2 cords it is normal, we can wait. If it is more than 3 or 4 cords, we have to do cesarean section. Okay, that will strangulate the baby, it will cause fetal distress. Okay, if it is short, if the cord is less than 30 centimeter, when the umbilical cord is short, what can happen? কি মুভমেন্ট হবে না, ফিটাসের ও তো মুভমেন্টের ইয়ে নেই, হ্যাঁ মুভমেন্টের জন্য ও তো প্রবলেম নয়. ওকে, it has very less space, it can't sing, dance and all, অতটা স্পেস নেই ভিতরে. Whenever the fetus moves inside the uterus, okay, the cord is small, what will happen, there is chances of cord avulsion. Okay, if the cord is short, okay, মানে short আছে, okay, say if it has to deliver or if it is like the way you said, এরম মুভ করছে বাচ্চাটা, কর্ডটা avulse হয়ে যাবে. Okay, and if cord gets, দেখো avulse হয়ে গেছে, হ্যাঁ আর avulse করিস না, ছেড়ে দিস ভাই. Because of this there is cord avulsion, okay, or there is premature separation of placenta. Premature separation of placenta, that will also cause bleeding, APH. ঠিক আছে. Okay, then what are the functions of placenta? What exchange? Yes, gaseous exchange. Then nutrition. Then excretion. Hormone production. What are the hormones produced by placenta? HCG. What is HCG? Then what is HPL? Human placental lactogen. Okay, then it produces estrogen. What type of estrogen does it produce? E3. There are three types of estrogen: E1, E2, E3. Okay, it produces E3. Okay, then it produces progesterone itself. Okay, um, one small concept. You said HCG. Okay, which part of placenta secretes HCG? Syncytiotrophoblast. Okay, what is cytotrophoblast and syncytiotrophoblast? Huh? আরে ওগুলো ঠিক আছে. What is cytotrophoblast? What is syncytiotrophoblast? Okay, and short I will just tell about the development. Okay, এটা একটু বোরিং লাগবে, ঠিক আছে, তাড়াতাড়ি বলে দিচ্ছি. You know what is morula? What is morula? 16 cell stage. Okay, see if this is the tube. Okay, fertilization হয়ে গেছে, embryo is formed on day 4. Okay, this will come and implant here. Okay, morula, babu, morula. Okay, this is morula. There are 16 cells. Okay, morula becomes what? Blastocele. 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 Okay, blastocele mane fluid will enter inside. It will swell up. There will be blastocele formation. Okay, then it will lead to blastocyst. This blastocyst, okay, this will get implanted inside the endometrium on day 6 to day 12. Okay, on day 4 it enters, day 6 to 12 it gets implanted. What is the blastocyst? No, it has what? This is inner cell mass, this is outer cell mass. This outer cell mass will form what? Trophoblast. This inner cell mass will form embryo proper. It will lead to form the ectoderm, endoderm, mesoderm and all. Okay, this trophoblast is of two types: cytotrophoblast, syncytio. Syncytio means there is no cell wall. Cytotrophoblast, cyto, there is cell wall. Syncytio, there is no cell wall. Okay, what happens? Okay, this is the endometrium. Okay, this is the basalis layer. This is the functionalis. Okay, the endometrium will come, sorry, the blastocyst will come. Okay, there is cytotrophoblast. Okay, and there is syncytiotrophoblast. This syncytiotrophoblast, what it will do? It has no cell wall. Okay, it will be like this loosely. Okay, there is no cell wall. Okay, this syncytiotrophoblast, what it does? The uterine endometrium needs progesterone. Puro pregnancy, the most important hormone is progesterone. Whenever there is a chances of abortion, okay, when we have pregnant ma ache, okay, for example she is 6 or 10 weeks, there might be chances of abortion. Okay, or it might be a high risk pregnancy. If she says I have a bleeding, okay, then what we do, we try to stop the bleeding and we give vaginal progesterone or oral progesterone. Okay, ma tumi eta khao for 2 weeks. Okay, আমরা বাইরে থেকে একটা progesterone support দিচ্ছি. Okay, whenever there is a possibility of abortion, we give progesterone from outside. But human body, what it does, there is progesterone production inside also. Okay, progesterone is produced from where? From the placenta. Okay, corpus luteum produces progesterone till day 12. Okay, after the 12th day, this our placenta will take the action of producing progesterone. Okay, this syncytiotrophoblast, what it will do, it will produce HCG. Okay, beta HCG it produces. This beta HCG, what it does, it will tell corpus luteum, কর্পাস লুটিয়াম তুমি প্রোজেস্টেরন প্রডিউস করো। Okay, so what happens is this beta hcg, no, this transition, it is from the 9 to 12 weeks. Okay, this 9 to 12 weeks only the mother will have vomiting tendency. Okay, initially at the end of the first trimester, when you see an antepartum mother, okay, every patient they will complain amar prochur bumi pacche, bumi hocche, ঠিক আছে, that is because of the hcg. Okay, this syncytiotrophoblast, okay, taratari bole dichi, syncytiotrophoblast is there. Okay, and this is what, cytotrophoblast. Next ki hobe, this cytotrophoblast theke cell gulo chole asbe. There is a layer of cytotrophoblastic cells penetrating here. Okay, and this syncytiotrophoblast, sorry, this what it will do, it will produce a proteolytic enzyme. এখানে blood vessels আছে. Okay, it will produce proteolytic enzyme and that will break the blood vessel and there will be bleeding. Okay, there will be bleeding in, this is called intervillous space. There is bleeding inside the intervillous space. Okay, এখান থেকেই আমরা মানে সাইটোট্রোফোব্লাস্ট সেলগুলো যাচ্ছে। Okay, and what happens, there is fetal circulation established, there is embryo inside. Okay, what happens, তারপর একটা আমি বললাম না ectoderm, mesoderm, endoderm, inner cytotrophoblast mass থেকে mesoderm, okay, mesoderm এর একটা লেয়ার চলে আসবে। So it will be like this, this is a syncytiotrophoblast, তার নিচে একটা cytotrophoblast layer আছে, তার নিচে একটা mesoderm layer, সরি mesoderm এর layer আছে, তার ভিতরে একটা blood vessel যাবে এরকম। syncytiotrophoblast, cytotrophoblast, mesoderm, blood vessel. Okay, this blood vessel, it will go and connect with this blood, so there is maternal and fetal interchange. Okay, bas that's all. আর কিছু ডাউট আছে? এনিথিং এলস? ওকে, টাইম হয়ে গেছে নাকি? হ্যাঁ, তুই তো তাড়াতাড়ি বলছিস, ক্লাস ভালো লাগছে না? ওকে, জাস্ট লাস্ট ওয়ান। ওকে, there are two types of placental separation when the baby delivers. Okay, this is uterus. Okay, this is placenta. There are two types of placental separation. One is called the skulls, Duncan. This is called shiny skulls and dirty Duncan. Why do we call shiny? Why do we call it dirty? Okay, because when the placenta expels down, okay, see this is inside the mother's uterus, we are seeing the placenta from outside. Okay, when it delivers, it starts separating from the center, then later what happens? No, see the separation will be like this, placenta will go like this. Okay, center আগে বেরোবে, তারপর periphery আগে তারপরে আসবে। So what we will see is the amniotic membrane first, so that is a shiny layer, no, so we call it shiny skulls. So the central part delivers first, we call it shiny. In dirty Duncan, what happens, the peripherally there is separation. Okay, when there is separation of placenta peripherally, what happens, there is sweeping of blood and we get dirtier, so we call it dirty Duncan. Okay, in this we see the blood after delivery of placenta. Here we see blood before delivery of placenta only. Out of this both, which method is good? কোথাটা ডার্টি বলছো, কোথাটা মানে শাইনি বলছো? শাইনি তাই ভালো, হ্যাঁ, শাইনি তাই বাজে, ডার্টি ইজ গুড। Okay, what happens because of this Cults method? Okay, when we try to remove the placenta like this centrally first, okay, the uterus also comes with this. What do we say that? It is called uterine inversion. Uterine inversion. Uterine inversion হয়ে যাবে. Uterine inversion is a what? It is an emergency condition. Okay, patient will go into neurogenic shock just like that. Suddenly. Okay, so we should avoid Skulls method. We should always follow dirty Duncan. Okay, so what we do is start separating the placenta peripherally, then we deliver it in toto. बुझे गेली? हाँ, tell me the difference between Skulls and Duncan. बोल. हाँ? Shiny, dirty. बोल ना. Tell me properly. What are the differences? हाँ. Okay. हाँ. Okay. That's all. ये तो किछु बोलছিলাম. So why we call it shiny? हाँ, first আমরা shiny পার্টটা দেখছি বাইরে. Dirty Duncaner, we see the blood first. हाँ. ঠিক আছে. বল, what is placenta suspensoria? কি হাসছিস কেন ভাই? তোমার আসবে কোশ্চেন. হ্যাঁ. Okay, what is the difference between suspensoria and spuria? Spuria তে blood vessel থাকে না. Okay, there is an accessory lobe, there is no blood vessel in spuria, but suspensoria there is a blood vessel. There is more chances of PPH in suspensoria. Okay, what is Vasa Previa? हाँ. Okay. Placental hormones are secreted from syncytial trophoblast.